How will I demonstrate pathogenesis of tuberculosis through a diagram? So the first stage is the infection before activation of cell mediated immunity. So what do we get to see here is, first of all, we have a alveolar macrophage. Okay, then suppose it has a receptor for mannose receptor CR3 and others. Here I have the mycobacterium, the causative agent. Now what will happen is it will bind with this receptor through mannose C3b and others. This is my alveolar macrophage. Now what happens is there occurs manipulation, phagosomal manipulation. Phagosomal manipulation, maturation arrest, lack of acidic pH, ineffective phagolysosome formation. Now what happens is this goes unchecked bacillary proliferation. Unchecked bacillary proliferation. Now during this, what will happen is bacteremia with multiple seeding at sites. Bacteremia with seeding of multiple sites. In the second step, what will happen is initiation and activation of CMI, cell mediated immunity. What happens is this alveolar macrophage, this has a receptor or a class 2 MHC, major histocompatibility complex. This has MTB antigen. Here we have T cell receptor, this is T cell. Now this has Th1 which releases interferon gamma. This leads to tuberculin positivity test. Tuberculin positivity. Now due to release of interferon gamma, the macrophage will become activated. It will become activated, due to which there will be mycobacterial killing. This will recruit the monocytes and will lead to the formation of epithelioid granuloma. Now how do you draw epithelioid granuloma is, you draw the core as caseous necrosis and around it you will draw sensitized T cells with nucleuses, obviously. Sensitized T cell. This is alveolar macrophage. Interleukin 12 acts on it. This is the activated macrophage. This is the pathogenesis of tuberculosis. Now we'll be covering the types of tuberculosis. The first one is primary tuberculosis. It is the infection of an individual who has not been infected or immunized against tuberculosis before. It is also called as Ghon's complex or childhood TB. It is produced in tissue with portal of entry with foci draining lymphatic vessels and lymph node, or foci draining lymphatic vessels and lymph node. Now it has three components. Coming on to the morphology, it has three components. The first is the pulmonary component. Second is the lymphatic component. Third is the lymph node component. In pulmonary component, what we see is Ghon's focus. It is a 1 to 2 centimeter solitary area of tuberculosis which is located peripherally under patch of pleurisy in any part of the lung, most oftenly in subpleural focus of upper part of left lobe. In the lymphatic vessel component, what it contains phagocytes containing bacteria, may be beaded and may develop miliary tubercles. In lymph node, what will we see? We'll see lymphadenopathy, that is enlarged hilar and tracheobronchial lymph nodes. And they will be matted. They'll show caseous necrosis. Now coming on to the microscopic examination, what we see is peripheral fibrosis, and a core of caseous necrosis. And the old lesions show fibrosis and calcification. Coming on to the outcome, what is the fate of pulmonary tuberculosis? One is that the primary lesions may heal by fibrosis. Primary lesions heal by fibrosis. The second is that the caseous material may be disseminated. Caseous material may be disseminated through bronchi, that is, it will lead to a progressive primary tuberculosis. Third outcome is primary miliary tuberculosis. In this, there is erosion in the blood vessel through hematogenous route, and it is spread to liver, kidneys, brain, and and spleen and other organs. Then in the fourth outcome we have progressive secondary tuberculosis. In this there is lowered immunity or resistance. There is increased hypersensitivity. It is mainly seen in children and immunocompromised patients. Now if I have to draw a diagram and show you, for healing you have to draw a lung. This is the bronchi. Here we have lymph nodes. Here fibrous calcification will occur and healing will take place. In caseous, the lower part of the lung will be affected. Miliary, you will show some lungs with beaded appearance, and then you will show the organs. And in the progressive secondary, there will be a lung and there will be an area where reactivation or reactivated lesions will be seen.